Inverted paralumbar anesthesia, anesthesia of the distal limb via vascular IV infusion, and anesthesia of the horn, the cornual nerve block in cattle. For inverted paralumbar anesthesia, for the procedure, for sedation, you use xylazine, ketamine, and butorphanol in a standing position. This is given intravenously. And then you prepare the site, you clip the hair and you scrub with iodine, and then you use alcoholic gauze. And you can also add 1 milliliter of sterile bicarbonate to the 20 milliliters of lidocaine. This is to decrease the sting effect. For inverted paralumbar anesthesia, you give multiple injections along the caudal edge of rib 13. It should be ventrally to the process transversus of the lumbar. So start from rib 13 and give injections all along to the tubercocci. The advantage of this is it's a very simple technique, and the locomotion is not altered, and you do not need deep anatomy knowledge. For the disadvantage, there's no anesthesia to the peritoneum, only the skin and muscles, and you need multiple injection sites, which is more painful for the animal and it has a higher risk of abscesses. And there's also high anesthesia costs because you have to do multiple injections. For anesthesia of the distal limb via vascular IV infusion, for the indications, this is done when there's surgery to the distal limb or the fetlock, for example, a foot surgery or a claw amputation. For the procedure, for sedation, you give xylazine, ketamine, and butorphanol. The animal should be in lateral recumbency. You prepare the area, you clip the hair, and you use iodine scrubbing, and you use alcoholic gauze. For the vascular infusion, use rubber tubing around the metacarpal or metatarsal. Wait a few minutes or seconds to identify the veins, and then insert a needle. It should be 20G or 22G. Do this without the syringe on first. Let the needle fill with blood. This is to avoid injecting air, and then you attach to the syringe. Aspirate the blood, and then inject 15 to 20 milliliters of lidocaine 2%. Then remove the needle and apply pressure at the insertion point. Then do the surgery and remove the rubber tube. For the cornual nerve block, for the anatomy, the cornual artery comes off the superficial temporalis artery, which comes off the external carotid artery. And for the nerves, the cornual branch comes off the nervus zygomaticus facialis, which comes off the nervus zygomaticus, which comes off the nervus maxillaris, which is trigeminal nerve 2. The indication of this is a carneonectomy. When doing the procedure, make sure the animal is restrained, it's standing and the head is restrained. Have sedation with xylazine, ketamine, and butorphanol. Prepare the base of the horn by clipping, cleaning, and scrubbing with iodine and using an alcoholic gauze. Then give anesthesia to the skin and perform the cornual nerve block. It's at the lateral edge of the frontal bone, as seen here. So it's halfway between the lateral canthus of the eye and the base of the horn. You insert a 16G or an 18G needle. It should be 1 centimeter deep in small ruminants and 3 centimeters deep in large bulls. You inject with 5 to 10 milliliters of 2% lidocaine, and then you wait 5 to 10 minutes for it to kick in.